We are here today at the SEEK National Workers' Comp and Occupational Medicine Conference, and I'm here with Dr. Jim Talmage, one of the nation's leaders on workability and effective return to work. Jim, why are so many injured workers slow to recover and return to work?
There are a number of issues. It's actually been scientifically studied, and the common themes that emerge are there's a surprising number who have what we call catastrophizing as a mindset. They're sort of, I can make a mountain out of a molehill and I can magnify the severity of the problem in terms of underlying personality. There are many who also have what are called fear avoidance beliefs, where they have the false perception that if they're doing an activity that causes an increase in their pre-existing pain from their work injury, that they're actually further injuring themselves. And many times doctors are slow to pick up on that's the problem. And then since it's a work injury, there's the issue of anger. And if you're mad at your employer didn't take your advice about changing a work practice or repairing a piece of equipment and it led to your injury, anger in many studies will hinder recovery.
So are there more effective ways to incentivize workers to return to work?
Yes, I think light duty that gets you paid at your regular rate as opposed to being off work and receiving 2/3 of your average weekly wage from workers' compensation is a financial incentive many times for injured workers to return to work. And the sooner the doctor can negotiate return to work with modified duty and get the employee back in the workplace and paid, probably the better we incentivize people to return to their original job.
So, Jim, how big of a problem is the unnecessary or medical overtreating of workers out on workers' compensation?
Varies state by state based on the state rules in terms of treatment, utilization, review, etc. But pretty consistent finding is that whatever the injury, whatever the surgery, more medical services are utilized in workers' compensation than if the same injury were being treated under health insurance. So more therapy visits, more chiropractor visits, more surgery. There is a clear element of overtreatment in many jurisdictions. WCRI has published that if the employer or insurer has control over who the treating physician is, it's an average 10% reduction in cost in the system, probably because there's less tendency to overtreat when the physician is chosen by the insurer or employer.
So how can the treating physician improve return to work for their patients?
I think the best advice for the treating physician is you focus on return to work at the first visit. And if you foreshadow what will happen over time, much easier for the injured worker to accept that. So if at the first visit you say, Steve, with this particular ankle injury, most people are going to be back to modified light duty in a week, and they'll be back to full work in 6 weeks, and that's what I would expect we will have so that you can plan financially for time off work, etc. If you outline potential recovery at the beginning, I think it makes patient expectation match with treatment recommendations.
So last question, Jim, what can employers do to facilitate early and safe return to work?
Single biggest things are probably choose the right physician who has a return to work oriented practice, and then accommodate injured workers, take them back on modified light duty, whatever you have to do that. If you have to create a job, get people back in the workplace as quickly as possible, interacting with their coworkers and getting paid, and that probably will facilitate ultimate return to work better than anything else the employer can do.
Thank you very much, Jim.